Cummings for organizing this task force. I'm proud to be part of it, and thank all of my colleagues who have worked on this issue for a very long time. As has been repeated, I think the United States pays more per capita than any other country in the world for prescription drugs, and these costs continue to rise. Last year, we've heard some examples of egregious instances where prices have gone up by 1,000%, 500%. But in addition to that, last year one study found that the increases for all drugs had gone up over 10%, and that families were being forced to cover those costs out of pocket or go without those prescription drugs. This is an issue which affects every single family almost in this country. And certainly in my state, in the state of Rhode Island, we have more than 80,000 seniors who are really impacted by this. Just last week, I met with Cecile, a woman in my district who was in her early 80s, and she described for me that she gets a written prescription from her doctor rather than having called it into a pharmacy, because she spends the first couple of days on the telephone calling every pharmacy in Rhode Island to find the cheapest price so she can afford it. And then she has to make arrangements to get transportation to try to get to that pharmacy, or she can't take her medication. This is America. That should not happen. And it's happening because pharmaceutical companies are gouging all Americans on these prices. Seniors who, by the way, just learned last month that they will not receive a cost of living adjustment for Social Security. And next year, their drug coverage as part of Medicare Part D are projected to increase by 13%. This is completely unsustainable. And as has been mentioned, this isn't just happening because the market is requiring it. It's happening because the market has been rigged for the pharmaceutical companies. We're not allowed to negotiate discounted prices. There's legislation to ensure that that in fact can happen, which will produce billions of dollars in benefits to the taxpayers and to people who are using prescription drugs. And this is not only an issue which is important to seniors, but it's really important to young people, to families, to people of all ages. And in Rhode Island, for example, I know this is happening in many states, we're dealing with a very serious public health crisis that relates to heroin and opiate abuse. And if you look at the number of people that are now being infected with hepatitis C, the numbers are growing. There are over 3 million Americans who are living with hepatitis C today. And 50% of all IV drug users will be infected within the next 3 years. So this is a public health crisis. Hepatitis C, as you know, can lead to liver failure, cancer, and death. It kills thousands of Americans every year, and that does not have to happen. When treated properly, it's completely curable. But the cure costs, as was mentioned, $84,000 for a 12-week course. That's $1,000 a pill, and very few people can afford to pay for that kind of prescription. And in Rhode Island, 65% of all Medicaid requests have been denied because of the cost to taxpayers. And so those individuals who could get that treatment and live a productive and healthy life are denied access to a healthy life. It should not be that way. And in the richest, most powerful country in the world, no one should suffer because they can't afford a life-saving drug. This task force will address that. This is a crisis in this country. We know the answers, we know how to fix it, and I look forward to working with my colleagues to make sure we do just that.
Thank you, David.